Hello, everyone. It's Friday, January 15th, and even though this is a terrible number, we've got to start off with going through the names and the people that we've lost. We've lost 62 people since Wednesday. Our death toll now is up to 1,733. I'll talk to you about that in just one second. Our 1,672nd death is a 95-year-old female from Mercer County. Our 1,673rd death, a 79-year-old female from Wood County. Our 1,674th death, an 89-year-old female from Mercer County. Our 1,675th death, a 96-year-old female from Harrison County. Our 1,676th death, an 81-year-old female from Kanawha County. Our 1,677th death, a 68-year-old male from Harrison County. Our 1,678th death, a 72-year-old male from Monongalia County. Our 1,679th death, a 91-year-old female from Jackson County. Our 1,680th death, a 67-year-old male from Raleigh County. Our 1,681st death, a 72-year-old male from Wyoming County. Our 1,682nd death, a 96-year-old female from Kanawha County. Our 1,683rd death, a 40-year-old female from Raleigh County. Our 1,684th death, an 84-year-old female from Cabell County. Our 1,685th death, a 71-year-old male from Wood County. Our 1,686th death, a 79-year-old male from Wood County. Our 1,687th death, a 63-year-old male from Berkeley County. Our 1,688th death, a 90-year-old female from Cabell County. Our 1,689th death, a 74-year-old female from Kanawha County. Our 1,690th death, a 79-year-old female from Wood County. Our 1,691st death, an 89-year-old female from Hancock County. Our 1,692nd death, a 91-year-old female from Upshur County. Let me just go back. I just kind of stepped on one another there, right? Okay. Our 1,691st death, an 89-year-old female from Hancock County. Our 1,692nd death, a 91-year-old female from Upshur County. Our 1,693rd death, an 80-year-old male from Mason County. Our 1,694th death, a 79-year-old male from Monongalia County. Our 1,695th death, a 79-year-old male from Marion County. Our 1,696th death, an 87-year-old female from Jackson County. Our 1,697th death, a 98-year-old female from Wood County. Our 1,698th death, an 89-year-old male from Berkeley County. Our 1,699th death, a 49-year-old male from Boone County. Our 1,700th death in West Virginia. Who would have ever in the world believed that we would be calling off 1,700 West Virginians we've lost plus? 1,700th death is an 84-year-old female from Jefferson County. Our 1,701st death, a 39-year-old male from Harrison County. Our 1,702nd death, a 77-year-old male from Cabell County. Our 1,703rd death, an 86-year-old female from Greenbrier County. Our 1,704th death, an 86-year-old female from Monongalia County. Our 1,705th death, a 73-year-old male from Marion County. Our 1,706th death, a 90-year-old female from Mercer County. Our 1,707th death, an 87-year-old female from Mercer County. Our 1,708th death, a 67-year-old male from Upshur County. Our 1,709th death, a 92-year-old male from Ohio County. Our 1,710th death, a 72-year-old male from Pleasants County. Our 1,711th death, a 93-year-old female from Wood County. Our 1,712th death, a 94-year-old female from Cabell County. Our 1,713th death is a 78-year-old female from Gilmer County. Our 1,714th death is a 90-year-old female from Wood County. Our 1,715th death is a 47-year-old female from Raleigh County. Our 1,716th death is a 91-year-old female from Wood County. Our 1,717th death is a 72-year-old male from Wood County. Our 1,718th death is a 72-year-old male from Wetzel County. Our 1,719th death is an 81-year-old male from Berkeley County. Our 1,720th death is a 77-year-old female from Lewis County. Our 1,721st death is a 95-year-old female from Ohio County. Our 1,722nd death is an 89-year-old male from Wood County. Our 1,723rd death is a 95-year-old male from Cabell County. Our 1,724th death is a 74-year-old male from Kanawha County. Our 1,725th death is an 82-year-old male from Tucker County. Our 1,726th death is a 98-year-old female from Wood County. Our 1,727th death is a 71-year-old male from Logan County. Our 1,728th death is a 93-year-old female from Greenbrier County. Our 1,729th death is an 84-year-old female from Kanawha County. Our 1,730th death is an 88-year-old male from Pleasance County. Our 1,731st death is a 52-year-old male from Marion County. Our 1,732nd death is an 80-year-old male from Putnam County. And our 1,733rd death is an 80-year-old female from Putnam County. 1,733 great West Virginians we've lost. Now back up and remember, please, please keep all these people in your prayers. Now, before I go any further, I want to talk, well, no, let me do these numbers real quick. In the last 24 hours, we've had 1,430 new positive cases. Our daily positivity rate is 5.17. Our cumulative rate has dropped 1/100 of a point. We'll take anything, that's anything but a gain, but we're at 5.46. I think we're at 5.47 before. Our active cases are 27,000, and our recovered cases are almost 78,000. Now, I'll show you this in just a second. I'll show you these graphs in just a second. But we have 1,717 people hospitalized and 195 in the ICU units. Those numbers are down a little bit. Now get this number. Our RT number in the nation is 0.90. It's the very best in the entire nation. We have 49 of our 55 counties currently in the red and the orange, and our mapping is getting a little better. All 55 counties are in the red based on an infection rate alone, but we look at it both ways. We look at it as a positivity rate, percentage, as well as infection. I remind everybody again, if you're older than 65 and you feel least bit unusual or whatever it may be, sniffle, headache, tired, whatever it may be, go get a test. The antibodies, and I'll talk to you in a second about the antibodies, but the antibodies, that can save your lives are out there. They're all over the place and everything. We can get them to you. We can get them to you fast if we can get them to you early. Now, everybody knows from 65 up, this terrible, terrible killer attacks those people first and foremost. Now, so I've said it over and over and over. There's no point in just keeping on saying it, except maybe just someone out there will trigger something and someone will really run to the fire as far as getting tested or whatever it may be. Now, let me just say this. I had the honor, the real honor, to attend General Yeager's funeral. So many of us, and me probably included to some degree too, while I know all of the accomplishments and while I have spent time with the General and Victoria and, from time to time and have been honored by their presence and everything, I was sitting there watching, the video play of all the dramatic things that he had done, and I was listening to 4 or 5 guys sing that were there, that were, singing, just the most beautiful, beautiful songs that was just tied directly to the video. If you think about it, he flew hundreds of different types of airplanes. He flew all kinds of fighter missions. Not only did he break sound barriers and do all that, but he was a commander, of troops. He absolutely was so special to our state, to this nation. A hero beyond belief. I am so glad that I was able to attend today, because one of the last things Victoria said is, some way, somehow, please don't let your grandkids or your great-grandkids or their grandkids forget this man. Don't forget his contribution to this country. She's right. West Virginia's own. And we should be very, very proud. If I could just jump back real quick and just talk to you just 1 second, our vaccine, distribution update. West Virginia continues to lead the nation. West Virginia has a 93.7% administration rate for all first doses of vaccines that we have received. Now, the bottom line to what is happening in West Virginia right now is just simply this. When we get the vaccines in on Monday, come Sunday nightfall, we're trying with all in us to not have one single vaccine on the shelf. We can only give you the vaccines that we have. We continue to push the federal government, and through that, I know, that the number of our doses of this incredibly wonderful vaccine are probably going to go up. And in the last 24 hours, we gave 12,388 vaccines. I told you just a second ago about the antibodies and how important that they are to get, and how important it is to get a test if you're feeling bad. We just received that we're going to get another 267 doses of these life-saving antibodies in next week. It just keeps on going. I said this the other day, but I want to say it again to you, and that is just simply just this, and that is, if you go to your doctor and you have only been feeling bad a couple of days and you get a COVID test and you test positive, and your doctor says, well, you really don't need these antibodies, you need to be asking why, and you need to be calling somebody because you need to be getting them. That's just all there is to it. The CDC posted the latest update of the COVID-19 vaccination tracker. West Virginia continues to lead the nation, just like I said, but that's not good enough for us. We want to lap the field. While everybody's standing around trying to figure up a system or trying to figure up something, and they're standing around twiddling their thumbs, West Virginia is not only leading the nation, we want to absolutely lap the field. There are a couple more national articles that just came out. I'm going to just read to you just a quote, and the first one is from, it's called The Conversation. I don't know where this came from, but it says, the article is titled, "The Reason West Virginia Leads the Nation in Vaccinating Nursing Home Residents. State and local leadership can make a difference. While a lack of federal leadership has been cited as a reason for the slow vaccine rollout, West Virginia succeeded in vaccinating nursing homes because it could be more nimble outside of the federal program. State and local leaders can succeed when they are held accountable and when they act proactively to manage the process." And this one was from the National Review, and it's got media play partisan games with COVID vaccine stats, their vaccination stats. Right now, West Virginia is doing a bang-up job of getting its residents vaccinated, and just about every other state should be looking over at this state's collective, they should be looking over that state's collective shoulder and asking, hey, what are they doing right, and what should we be doing? It's good stuff for West Virginia. Now, as far as save our wisdom, you know, our COVID clinics that we held this week, you know, all of them will be finished with all of their vaccines at 5 o'clock today. That's really good stuff. As Operation Save Our Wisdom continues to ramp up, I encourage all West Virginians who are 70 years of age and older to take advantage of this opportunity to receive these life-saving vaccines. Now, we will be dropping that age to 65. I know we've still got a ton of 70-year-olds and a bunch of 80-year-olds plus that we still need to get, but they can come too. But we'll be dropping that because the CDC and everybody has made that recommendation to go to 65. And basically, I don't want them to hold up the number of vaccines we're sending out because we didn't follow their lead. So far, there's been, get this, 34,529 individuals in this state, 75 years of age and older, who have chosen to get this vaccine, and 2,900 who are now fully vaccinated. So they've received 2 shots. Next week, we will follow the same regional community vaccination approach, and there'll be 17 clinics next week. My team met today with all counties to encourage them to begin planning for future events as our vaccine supplies increase. And I want to be perfectly clear that all of our counties play an important role in getting folks vaccinated. This is an all of West Virginia approach, and we need each of our partners at the table in order to maintain our success. And basically what we're saying there is just simple as mud, that I always say, and that's just this. You know, we have some very rural counties, and you know, for us to be able to get this wonderful vaccine to all 55 counties, we've got to have all the health departments and everybody in every county all in helping us, because we just don't have the number of people that can cover every single county without running a risk maybe of losing some of the vaccines from the standpoint of them going bad, and we don't have enough people to get vaccinated and everything else. So we just need your help. We really, really need your help, and we'll get the stuff there, and we'll continue vaccinating people, and we're going to stay right up with it, and the more they'll send us, the better. We have some guests today from Harrison County. Today, the executive director and the health officer are with us from Harrison, Clarksburg Health Department. They're joining us today. Yesterday in Harrison County, we hosted an Operation Save Our Wisdom clinic, and 550 West Virginians received a first dose of the Pfizer vaccine. Residents of at least 6 counties were vaccinated at the Harrison County Clinic. All who were vaccinated left with an appointment to receive their second dose. Now I'd like to introduce 2 wonderful people. That's Dr. Nancy Joseph and Chad Bundy.
Hello. Sorry. Chad's coming on. I just want to say that it was absolutely incredible to be a part of that large community event. We had so much help from so many people, and the folks that came, the citizens of Harrison County and the surrounding counties, they were excited to be a part of it. They were encouraged. We saw hope. And I'm really, really proud of them for coming out and leading what we hope will be many, many more clinics where we can get many more vaccines out there.
And I just want to thank our many partners from several counties and several, I think 16 different agencies within inside of Harrison County. We couldn't have done it without them. And we adjusted on the fly and were able to move forward with best serving those folks who came to our clinic because of their great help.
Well, listen, guys, I can never thank you enough, and just keep on doing the good work. We're just going to keep pushing on this end, get the vaccines here, and make them available to you, and get them right out and get them in people's arms. That's the whole thing. If we can continue to do that, that'd be really good. Well, again, thanks for joining, and we'll hopefully be right back there next week and doing some more. That'd be really neat.
Thank you, Governor.
Info line just came up. We just put it together. You know, it's open on Monday through Friday from 8 to 6 p.m. and on Saturdays from 9 to 5. The number's up there. All the rest of the stuff is there. You know, the vaccine reminders, you know, is that, you know, just this. Taking this vaccine, there's no chance that you're going to get COVID taking it. And just like anything in life, I can't guarantee you 1,000% of anything. But I can guarantee you this. Your probability of having a big time issue with COVID is real. And you better listen to me on this. If you've got the chance to be able to get your vaccine, take the vaccine. Just tell me where in this country, where in this state, for all of us that have taken the vaccine, where is there somebody that's really, really struggling right now? And there's probably somebody. I don't know of anybody. You know, so the safety of it has got to be real. There's tens of thousands of people. There's millions of people now that have taken this. Take your vaccine. Absolutely, it is really important. I told you about the antibodies. We've got them. If you've got a sniffle, get tested. We'll get you the antibodies and probably save your life. All the testing stuff's up. Again, thanks to the drive-through pharmacy effort that's, you know, that the people at Walgreens and Fruth are doing. It's really good. We have 99 outbreaks in our long-term care facilities now. We have 9 active outbreaks in our churches in only 5 counties. This is the very best it's been in a long time. Marion, Mingo, McDowell, Nicholas, and Summers County are the 5 counties. Keep doing the good work you're doing in West Virginia. You're doing great. We are down now that there are 77 inmate cases. Remember just the other day, you know, we were 380 on Wednesday. We have 77. And, you know, and all that is just, you know, again, a salute to corrections. They've done a wonderful job, you know, and let's just keep at it in every way. I keep telling everybody, you know, wear your mask. Come on, we're getting somewhere now. We're getting some traction and everything. Wear your mask. You know, get your flu shots. And if you have a chance to be able to give blood, we could really, really stand for you to be able to do that. Our schedule for this next week, since Martin Luther King Day is Monday and the inauguration is on Friday, we're going to go on Tuesday and Thursday with the briefing, or the briefings that we're going to be on Tuesday and Thursday of next week. Another announcement that I've got is the National Guard is now sending 275 guardsmen and women to D.C. for the inauguration activities. Please keep all of them in your prayers and everything. They've done phenomenal for each and every one of us in West Virginia over and over and over. The last thing I want to tell you is just this. I want to go back to our maps or our graphs. You know, Jordan, if you could go back to them just a second. Okay. look at the middle graph. Look at our daily positivity number. Look how the graph is moving a little bit our way. Look at the bottom graph. That is our cumulative, our total positive percentage. And look how it is just starting to barely tilt our way. It hadn't done that for a long time. And look at the top graph. The top graph is the number of active cases in the dark blue and the number of recovered cases in the light blue. And look, for the first time in a long time, those are beginning to really move in our favor. The wider they get, the better we are. The active cases going down a little teeny bit, and our recovered cases continue to go up. Good stuff. Now, let me tell you, I would say this. These graphs, one robin doesn't make spring, does it? That's all there is to it. The first robin that comes buzzing in and we think, oh, good, spring's finally here and the winter's over and everything. A lot of times we turn around and get blasted. Big snows, cold weather, whatever it may be. But I am telling you, with the number of people that we are leading the nation and getting these vaccines in people's arms, and with really and truly the effort that is going on everywhere across this state to try to wear masks and do everything we're doing, this thing is starting to move, and the numbers and the graphs and everything are starting to move our way. It's always my role to try to give you hope. It's never my role to try to paint a rosy picture when things aren't very good at all. We still got a long ways to go. I'm really happy that we're going to be going back to school, especially for our kids, that are 8th grade and under. And, and as our map continues to get better and better, hopefully our 9th grade through 12 can be back in a really, honestly, just right around the corner. So with all that being said, we're going to have a bunch of them be able to go back the way it's stacking up right now. And we just need to keep doing what we're doing, West Virginia. This is a terrible killer, and it's absolutely swept across our nation, and it's eaten us alive. But you have absolutely led the way over and over. Be real. We were the first, I think, in the nation on the nursing home visitation to stop that. First in the nation to test everybody in the nursing homes. First in the nation to test all the assisted living. I'm going to miss a bunch of them. Along the way, we've kept the economics moving our way. Made a real move as far as going back to school, with our 8th grade and on down. Then right behind that, vaccines start rolling in, and we absolutely delivered hope to our elderly, and we moved. We pivoted. We moved. I've been called a lot of things, but being called nimble, I don't know how nimble I am, but nevertheless, that's what this reporter just came up with and said, but that's what West Virginia has done. We have moved. Instead of studied and developed programs and everything, we've moved. We've given hope, and we've led the nation. And by that being said and everything, that's what we want to continue to do. There's lots and lots and lots of good that are still coming our way. There's additional aid to those that are unemployed. There's additional aid coming in the form of additional CARES money that's going to our schools to make things better there. There's going to be a big hit that's going to come to additional things to our schools, and with the possibility of even things to our counties and our cities as well. So with all that being said, just hang tough, West Virginia. Keep doing the right stuff. We're going to get through this. We're doing really good compared to an awful lot, but we still got 1,733 people that I want you to keep in your prayers. Thank you so much.
All right, thank you, Governor. Let's now go to retired Major General Jim Hoyer, the Director of the Joint Interagency Task Force.
Good afternoon. As Governor Justice pointed out, we've made great success this week with vaccine distribution. He provided you the numbers, 93.7% on first doses and over 80% on second doses. We are on pace to have a great week this week. We continue to build out the network as the governor described. There were 280 participants on the Zoom call today, led by Joe Peel and Dr. Deb Keister from the Interagency Task Force, continuing to build out that network to get down to those local levels, as well as to build out the additional larger sites with our hospital partners to be able to get large amounts of doses in arms as quickly as possible, because we know, as the governor has told us many times before, a shot in the arm is an opportunity to save a life. We at the Interagency Task Force take that daily and work with it as our mantra to make sure that we are getting shots in arms as quickly as possible. As the governor also pointed out, there's a lot of great work continuing to go on with DHHR, the Guard, and other partners on epidemiology data, as well as on the testing piece. And all of this must continue along with our mask wearing to make sure that we can get through this and West Virginia can lead the charge. Thank you very much.
All right, thank you, General. Next to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. In following up what the governor has said and General Hoyer, I think it's important to realize, excuse me, I think it's important to realize that West Virginia is shining to the rest of the country, but that we have always known that West Virginia always shines. And the success that we've had is due to the leadership of the governor and of the leadership here in some part, but really it's due to each one of you. We have finished vaccinating twice 22,600 people. We have vaccinated once 124,000 people. We, I believe, have been successful because of the support and the commitment of each West Virginian to run to the fire, as the governor said. We've had a very clear vision. The governor's had a very clear vision of what we want to accomplish as a state. We want to save lives. We want people not to be sick, to live well. We want to maintain our critical capacities at the hospital level and at the community level, and also our critical functions. We want to get our children back in school safely and create the safe environment for our teachers to be in as well, so that we don't lose a generation to education. And the governor said many, many times that we also want to focus on our most vulnerable people. And that's why we're so proud of the fact that we've finished vaccinating our nursing home residents, and we'll finish that second dose imminently, but also that we are turning toward our most vulnerable older population, our over 80 population, then now over 70 population, and immediately going to the over 65-year-old population. And as we've talked about, the number of people that have died 60 and over in West Virginia has been, that accommodates the ages of 97% of the people that have died. Remember, as the governor said, when it becomes your time to get vaccinated, please choose to be vaccinated. We know that you need 2 doses of the vaccine to get the maximal benefit, as was found in the clinical trials that were done. And it takes about 2 weeks after the second shot of the vaccine to really have the peak levels of protection. And many people I know have been worried because they haven't had that opportunity to get their vaccine. And as the governor and General Hoyer and everybody else has said, we are pushing very hard, not only to move vaccine to people's arms, which is the way that we help protect people in West Virginia, but also to get more vaccine. And the more we use, the more we believe that we will get. And so we are pushing hard to do that. But as the governor said, remember, we have a vaccine that doesn't require a needle in the arm, and that vaccine is called a mask. And if everybody wears a mask and everybody protects themselves, stays physically distanced, stay at home if you can right now, then we will be able to block the transmission of COVID-19. And we're all very proud of that reproductive number as best in the country, which is really due to the great work of all West Virginians. But remember, you have power and you can protect yourself during the time you're waiting for the vaccine. And please, when you have the chance to get the vaccine, choose to do it. Thank you so much.
All right, thank you, Dr. Marsh. Next to Dr. Ayn Amjad, our State Health Officer.
Good afternoon. I do want to remind everyone that we still have free testing available for everyone in the state. If you go on our coronavirus website, it is under free testing. So it is important to remind everyone that if you are feeling sick or you're not sure, or if you're attending any events that you might think you've exposed yourself, that we still offer free testing sites around the state. So if you visit our website and you want to get tested, we still offer that. So as the governor reminded everyone this morning, or this evening actually, that if you're feeling sick and you're not sure, to still go and get tested, that is still available up on our website. Thank you.
Thank you, Doctor. And finally, to Secretary Bill Crouch with the West Virginia DHHR.
Good afternoon, everyone. Governor mentioned the call center. I want to thank our folks at DHHR that's been operating a couple of weeks now. We are getting thousands of calls a day. We're seeing high traffic volume at websites and on the call line. So we want to ask everyone to please be patient. We're pleased to see so many people excited and interested in the vaccine. We will get to everyone. Eligible residents may encounter some delays. We're having call wait times of about 2 minutes or so. So please be patient with our folks. We ask that you call back later if you can't get through. Appointment availability is limited right now, as most of you have heard, but we will continue to open up slots as quickly as vaccine is available. Our problem right now is we can't get enough vaccine from the feds, and the governor is doing great things to get vaccine pushed to us. So we are #1 in the country, and we're all very proud of that. So we thank you for your interest, and please, when it is your turn, please get vaccinated. Thank you.
All right, thank you. We'll now go to questions from members of the media. The first today from David Beard with the Dominion Post.
Hi, my question comes to me from Preston County, where they've asked me if there's apparently no plan next week to vaccinate the school teachers and staff. They want to know why that is and when you might be getting vaccines up to that county. Thanks.
David, I think Hoyer can go, General Hoyer, but I really, General, you go. I mean, I thought we were scheduled for this week, but anyway, go ahead.
Yeah, David, we are, yesterday and today, we're vaccinating 9,700 teachers that make up the additional list of teachers 50 and above who we had worked with the State Department of Education on. State Department of Education has worked with each county board related to those teachers. If there are other teachers out there in that 50 and above group, we will continue to work on those going forward. And as mentioned earlier, there were 280 participating individuals representing agencies on the call today, working for the future vaccinations within all of our 55 county areas.
All right, thank you, David. Next, we'll go to Paul Mullen with WCBC.
Come back to me. I really think this number is greater than this, but I was just told by our people here, in general, maybe you could follow up on this too, but between last week and today, we've done right at 19,000 teachers and service personnel, and that's a big number, but I think, I thought it was maybe even possibly even higher, but General, if you could weigh in again.
You're correct, Governor. Over 19,000 teachers over the past 2 weeks over the age of 50, to include service personnel over the age of 50, have been participating in the efforts with the State Department of Education and the county boards to be vaccinated.
I'm just asking, I'm being one of the media now, but what is the percentage of those folks that we have, the total number 50 and above that are taking the vaccine?
Governor, there were provided by the Department of Education the original list of those 50 and above teachers and service personnel was 24,000 individuals that were identified, but over 19,000 signed up to take the vaccination. State Department of Education, Dr. Birch and the team continue to work to identify if there were others out there who may need the vaccination in that age group.
Well, that's 80% right on the money. 19.2 would be 80% of 24,000, and that's really pretty good. We want it to be 100%, but we know that you've got some people that are still reluctant, and some people just hard-headed and whatever it may be. But nevertheless, that's still pretty good. If we got 80% of our teachers and our service personnel, way to go, teachers and service personnel. That's good.
All right, next we'll go to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. Question about mail delivery. This is COVID related because the mail hub in Baltimore has had a COVID issue and has slowed mail delivery to a crawl. I got a contact out of Mineral County today that they have been receiving bills that are due after the due date, and they have been tacked on with late fees. Is there anything that you can do to avoid to take care of those late fees, Governor? I know you can't do anything about the mail service in Baltimore, but people in the Eastern Panhandle and North Central West Virginia are running into a big issue here. Some of them are just getting their Christmas cards, by the way.
Bill Crouch, try to answer it. I don't know. I really don't know what the answer is here. Bill, do you have any answer?
Governor, I don't. What is, Paul, if you could elaborate a little bit more, you say the mail's late and bills are being sent with fees on the bills for what services?
There are bills that folks are getting for utilities, electric, gas, and the problem is that they are getting the bills after the due date, so they are late. And they're late before they get them. And they are getting tacked on with late fees. And this, I think, is restricted right now to the mail service out of Baltimore that affects the Eastern Panhandle and also the north central part of the state. But there are a lot of people that are being affected by this. And they're getting socked with fees, and things have come to a crawl.
Oh, listen to me on this. We'll check it out, and I understand if somebody's getting stuck with a late fee, it's not humorous to them, and we'll check it out. But unless they're just, unless COVID is causing us a backlog with the mail, we got to figure out what it is. And Secretary Crouch, this is your baby to check out, okay? So if you'll just check it out and then get back to us on it, please.
All right, thank you, Paul. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hello, Governor. Congratulations on the #1 ranking in the nation. But as you are famous for saying, you always want to do better. And in the last couple of days after the mass vaccine appointments were set at the Charleston Coliseum, yesterday and today, I've had probably 3 dozen emails and calls from seniors, 70 to 80, who are relaying stories that, they're calling 62 times and nobody's answering, it's busy. And one woman said she called 102 times. Another household had 2 phones going at once and nothing. And then you get messages from Southern West Virginia in the rural areas where we've created these spokes for distribution. General Hoyer talked about that, but an 84-year-old gentleman said that they've got a challenge to go to their spoke, a 2-hour round trip to a clinic, but he and his wife, difficult traveling, and their local clinic in Greenbrier County wasn't given any vaccine. Difficulty finding information with local health departments who are overwhelmed and exhausted, obviously, because of the demand. I know that demand is far exceeding supply, and I know that's your biggest problem. But what can you do, if anything, to alleviate the fears and concerns of these people that are 80 who said, you get this thing, you're going to die. They're trying desperately to get appointments, and they are striking out left and right. And remember, this is a population that, not to generalize them or stereotype them, but maybe not as familiar with technology and the internet and dealing with the modern conveniences that would help them get appointments. How do we help that population? Thank you, sir.
Kenny, I love the question, and everyone, please, it's out there that 70 plus, 65 plus, 80 plus, listen to me and listen really good. 2 weeks ago, the outlook for you and the possibility of you getting a shot was probably April. That's all there is to it. And we pivoted here and we did the right things and we pushed the right buttons, and lo and behold, we started being able to get shots in arms of people that were 80 plus and then 70 plus, and we're going to try to go 65. I absolutely understand. From our standpoint, we can do better. I know it's a tireless effort and everything, but we can do better, as far as, maybe trying to manage the phone lines or give you more and more information. For crying out loud, don't anyone feel bad about not being as tech savvy as somebody else. I carried a flip phone forever. In fact, I've still got I've got 2 phones now because, these, I don't know, people that aren't, I don't understand people's motivation, but I've got an iPhone and I've got a flip phone as well and everything. But, so don't feel bad about being not as tech savvy as our young people are today. But the bottom line of the whole thing is just this. If I've got 25,000 vaccines that I can give out, we're trying as hard as we can to encompass all the counties and yet be able to get them out really fast. We can slow it down by absolutely going to every single place, even every single drugstore or whatever it may be, and we can slow it down. But as soon as we slow it down, we're not going to get more and more and more vaccines. We can't slow it down. Do you understand? If the federal government sends us 25,000 and we get them out, boom, the likelihood of the next week the federal government sending us 50,000 has greatly improved. The only way that I can get the federal government to up our numbers is get them in people's arms right now. The only way I can get them in people's arms right now is I've got to be able to do it in some form. I could say, well, we've got 25,000, we're going to have 20 sites, and the first come, first serve gets them. And before you know it, we're going to create a food fight on the sites and everything where you've got elderly people that are driven there. It's a long drive. They got to go, then they didn't get their shot because we ran out, and all kinds of different situations can happen. I absolutely hate like crazy that somebody's called 102 times or 62 times and not getting through. But it is a whole heck of a lot better, than to show up and it be 3 degrees outside, burn up gasoline and all the different things that that can happen, a possibility of a wreck or whatever. Just bear with us. We're getting more and more vaccines, and absolutely we're going to touch every single one of these rural counties. And like I said, versus where we were to where we are today, on January the 15th, we've gotten in 35,000 plus shots to our elderly right now. 35,000 vaccines. And we have vaccinated in excess or right around 150,000 people in the state of West Virginia so far. 35,000 to our elderly. Now, compared to where we were 2 weeks ago, was 0 to our elderly, 0 until April. So it's a heck of a lot better than where we were, but it still can continue to get better and better and better. That's why I love the question from Kenny and everything. And absolutely anybody that knows me knows just this. And gosh dog, I am almost apologetic about this. But, you know, to our general, to our coronavirus czar, to all the people that have to work with me and put up with me all the time, I mean, we were leading the nation. And we were at 47% of the total number of vaccines we got in. And I went crazy, completely crazy about saying it isn't good enough. It's just not good enough. And we're going to end up with vaccines on the shelf. It's not good enough. And not only now are we not leading the nation, we're lapping them. We're running all across them and everything else. And the only thing I'm concerned about is they're going to string the tape across the finish line and let somebody that's been lapped run across in front of us and everything. But absolutely, I'm just teasing. West Virginia, you're doing great. We're going to continue to work at Kenny. We're going to continue to try to make it better for our people that are calling in. I hate like crazy somebody's called in 60 or 100 times. We're going to make it better. We're going to just keep making it better. And West Virginia's done pretty dadgum good right now.
All right, thank you, Kenny. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. This morning, the Washington Post reported that despite the fact that the Trump administration has said they want to release the vaccine reserves, that there currently are no reserves and states should not expect an increased supply. What can you tell us about what we're hearing from the federal government about what we're guaranteed to receive? Thank you.
Okay, Charles, let me just answer this because I think I got this. Charles, we have pretty much been assured, in fact, we've not pretty much, we were assured that we were going to be bumped up 25,000 next week beyond our allotment. We asked for way more than that. We asked for 110,000 bump up, but we do believe we're going to get close to double the vaccines next week that we originally had in the pipeline ordered, In addition to that, Charles, one of the things where we kind of halfway, you can't say dropped the ball, but our interpretation was just this. Let's just say that you had, 35,000 people or 30,000 or 20,000, whatever the number may be, that were eligible coming next week to get a second shot, okay? Now they're almost saying to us that we're going to treat all shots the same, because by the time we get to the point where people are needing second shots, the turnout, the pumping out, the production of the vaccine is so good, we're not going to have to worry about holding some back to be able to give them the second shot. Well, I don't know that I buy that. I don't know that I completely buy that. But the net of what our great guardsmen and ladies are doing is just this. They're trying to protect against having people and not having a second shot here and being able to utilize all the first shots, or all the stuff that comes in, just continue to get stuff in people's arms and everything. The net of the whole thing is Charles, you asked one other question. And we were told, many people have said that, listen, we have the vaccines and we're going to be sending out more vaccines and more vaccines. Well, you don't really know what's going on, from the standpoint of people all across the nation and everything. And I'm trying to read but nevertheless, Charles, what we're told is, let me go, I kind of lost my thought and everything, forgive me. But what we were told is next week, we were going to get double the amount of vaccine. It all changes. And now, from what I'm being told by my people here, that may not be exactly right, and it may very well be that we only get the 25,000 and we don't get the additional 25,000. In 10 minutes, it'll change again, you know. But you ask a question of, we've been led, I mean, you almost said we've been semi-led to believe that we had all these additional vaccines and they could be sent to the states, and now maybe we don't have all these vaccines, and maybe we don't have the vaccines to send more supply to the states. You know, Charles, I don't really know the answer to that other than just that we've been told the same thing. We've been told we have additional vaccines we can send to the states, and then we've been told we're scrounging around and looking everywhere and we can't really find anything that's not already set in the pipeline. And you know, I just go back to one thing, and it's just this, is these people are doing and have done a wonderful job, and considering all the obstacles that they're dealing with, but you know, all I know from the standpoint of West Virginia that we can do is continue to scream and holler and jump up and down and do everything we can possibly do and be respectful and reasonable and all that with it, and trying to get more and more vaccines into West Virginia. And the best thing we can do is, when we get them, no matter what we get them in somebody's arm.
All right, thank you, Charles. Next to Brendan Tierney with WSAZ.
Hi, Governor. Brendan Tierney with WSAZ News Channel 3 here. Following up somewhat on what Kenny had asked, have you considered creating some sort of statewide appointment system or wait list system so people are able to call and get their name on a list like what Ohio has done? And how is this going to work once we get to the point that the general public's getting vaccinated, when there's a lot more people who will be in line for vaccinations?
I think General Hoyer, General, maybe you can answer this one, you know, because I'm kind of out of breath.
Yes, sir, Governor. So, Brendan, yes, as Secretary Crouch pointed out, we are increasing our capacity at the call line. We are also working to identify a process to potentially use the statewide call line to help with that. In addition to that, the 280 individuals that were on the call that I discussed earlier, we are working a pull system where we will work with local level individual organizations to identify how to identify people in the appropriate age ranges with the appropriate medical conditions to be able to work the scheduling process across a variety of different platforms. So a lot of work going on to address the issues that the governor described, that we are working hard to get shots in arms.
Back to me, Jordan, please. You know, Brendan, I just checked this real quick and everything while the general was talking and everything, and I was catching my breath. But imagine this, we just reported to you that we had 93.7% of the vaccines that we've received in West Virginia are in somebody's arm. I mean, we just said that. Now, do we want to be Ohio? Ohio right now has 37% of the vaccines they've received in somebody's arm. You know, it's just like we got into the thing before where people were saying, well, they don't require wearing masks and everything in South Dakota and everything else. And I said, my God, living, do you want to be South Dakota? I mean, they had the number one, all kinds of issues that were going on in South Dakota. I don't want to be Ohio. We're at 93.7%, and they're at 37%. Whatever we're doing, we need to keep on doing it. You know, there's an old saying, you know, in a football game, if you run a play and they can't stop you, keep running the same play. Run the same play until they do stop you, and then we'll go to something else. All right, Jordan, I'm back to you.
All right, sorry about that. Thank you, Brendan. Next, we'll go to June Leffler with West Virginia Public Broadcasting.
Hello, Governor Justice. So I'm asking a question on behalf of our education reporter here at West Virginia Public Broadcasting. So we do know that some districts in West Virginia are not planning to go back to in-person learning as soon as your executive order is asking them to. So I'm just wanting your reaction. You know, do you support their autonomy, or are you really going to pressure them to go back?
Well, I don't really think it's my call, you know, in the first place, as far as pressuring them to go back. I mean, that's the Department of Ed's call, and the Board of Education. You know, they made their rulings and everything. You know, and I think without question they ought to be back in school. But I think that's going to be completely up to them. And I think you know, Dr. Marsh ought to weigh in just 1 second and just say again how safe the schools really are, 8th grade and down especially. But that's really not my call. You know, I have put my stake in the sand and said, you know, I think from my standpoint we ought to go back to school. But then, you know, the governing body is the Department of Ed, and the Department of Ed is going to make those calls. But nevertheless, Clay, go ahead.
Well, thank you, Governor. We know that looking at our own epidemiology data for the last school year, that we saw very few secondary transmission, in other words, spread between people in classrooms, and the only real evidence of that or incidence of that was in classrooms where people could not wear masks very well, like in a special education class. Otherwise, there were outbreaks at schools, but they were between people that had acquired COVID in the community and then been in meetings with each other or lunches or sports teams without masks and passed that back and forth outside of the classroom. And what the literature is that the governor alluded to, study that just came out in the journal Pediatrics that looked at North Carolina schools in the last school year, in the 2020 school year, and found that there was 0 incidents of spread from a student to a teacher. A lot of people are nervous about the new variants that are coming out, but there was a study that recently was published from the United Kingdom, and the transmission of even these the mutant virus, the United Kingdom mutant, which is a mutation, multiple mutations in that spike protein, that if people were wearing masks and doing that good protection in a classroom, then spread was extremely rare as well. So we do believe, and if you look at the American Association of Pediatrics and other groups, that we do believe that the schoolroom is actually, if all the precautions are taken with masks and distancing and testing and contact tracing, just like in a healthcare setting in a hospital, that these places are actually safer as far as spread of COVID-19 than in people's homes and communities. So it is important, and almost everybody, including Dr. Fauci, has recommended that we get kids back in school. And the 15 and under kids study from Iceland that showed that the risk of getting disease from that aged child and transmitting it was half of which was found in children over that age. So from the data we have now, it looks like getting back in school is safe for both students and teachers, and we know how important it is from the communications that Clayton Birch has said, and other people who are experts in education. So thank you.
Give me just 1 second, Jordan. Okay, let me just say just this. Have we not said this 50,000 times? We're dealing with a pandemic, right? We're dealing with an absolute killer. There is no possible way that anybody can make any single place absolutely, completely, perfect, and totally safe. Now, we know all that, don't we? And the other thing we know is we know this, all the health experts, all the scientific research says that the transmission possibilities from 8th grade down is next to nothing. You are far more at risk, as so is our children, or so are our children, you know, if they stop at a Go-Mart or Walmart or go outside or go to each other's houses or whatever, than they are at school. Now, we also know, fact, that absolutely, if we don't go to school, that our kids are failing, our special needs kids need us, without any question whatsoever. You know, we have all kinds of abuse and situations that we can really help our kids if we're in school. Plus all the economic aspects of it, of daycare and mom and dad's having to be disrupted from the work and everything else under the sun. Now, the net of the whole thing is just as simple as it can possibly be. We need to be in school. We absolutely need to be in school. We need to be in school right now. Now, if we have teachers' unions that are, you know, pressuring a weak Board of Education members and whatever like that, and they decide, for whatever the reason may be, that they don't want to go to school, then they're going to have to deal with the Board of Education and the consequences that come from the Board of Education. You know, but in all reality, we can't make it any better than what it is right now. On top of all that, if that wasn't enough, and I'm going to review very, very quickly, if it isn't enough to say that we know that the schools, 8th grade and down, are as safe a haven as we can possibly there can possibly be. We also know that kids not in school are getting harmed terrible. And we also know the economics of the family that depended on their kids to being able to go to school is terrible. And what did we do on top of all that? If that's not enough to say to everybody, it's safe to go back. All the scientists are saying it. All the medical community is saying it. Everybody's saying it's safe to go back. Well, we ought to just go right there. That's all there is to it. Or we ought to say, it's safe to go back and our kids are hurting. We ought to go right there. But then what did we do on top of all that? We said, we're going to vaccinate all of our people. We're going to vaccinate all of our teachers and all of our service personnel. Now, I'm going to tell you. And then we even said, if you want to go blended until you get your second shot, that's great too. But we can't go just remote because of all the reasons that I've just explained. And if that's not good enough, then you're on your own. You're on your own. You know, absolutely. To me, you know, the Board of Education or the state board and Superintendent Birch and everything, they make that call. All I can do is just say, from the governor's standpoint, the governor's executive order is go to school. You know, but however, the governing body is the Department of Ed.
All right, thanks, June. Next to Katie Coyne with the Charleston Gazette-Mail.
Hey, Governor, thank you. I hope that you will make an exception today and let me ask a clarifying question before I get to my actual question. Going back to Charles's question about the Washington Post article about the reserve of vaccines not existing, can you clarify your response in that? Are we not getting the same amount that you expected? Are we getting more? Are we getting less? Seems that maybe you got a piece of information in the middle of that answer that maybe may have changed it. Can you clarify that?
Well, the only way I'm going to be able to clarify is to tell you that I don't really know. You know, 1 minute we're told by the governing bodies and everything that we're getting, I think next week we're online for 23,000 and then we were to get another additional 25,000. We're told that. I mean, we're told point blank that we're going to get right at 60,000 doses next week. Now, some of those are for second shots, but that's what we were told. Now I'm hearing that maybe the additional 25,000, they don't have it. But what I'm telling you is that may very well change in 2 hours. That's what's happening. That's exactly, I mean, just think, when we were cut back, you know, we made our original orders, and the general can give you this. We made our original orders, and then all of a sudden, I think in the second week, we were cut back. And then we went back, you know, to where we were. But from my standpoint, what I've got to do is I've got to continue to try with all in me to get our numbers increased. That's what I'm doing. Now, the second part of your question was what I'm sorry.
Yeah, so the second question here, we're following up on your last answer, you're talking about kids going back to school. You say, you know, we know that there's very little spread of those 8th grade and down. We have counties though, like Boone County, where upwards of 50% of families or kids are being raised by grandparents or have grandparents in their home. Even if the kids are safe and the teachers are vaccinated now, you know, why are we waiting until everyone can get vaccinated at the schools to send them back in order to stop the risk of bringing that spread back home to grandparents who may be raising these kids?
Saying, why don't we vaccinate all the kids in the schools? Was the question?
No. Why are we rushing kids back into school on January 19th before teachers can get second doses, when many children live and are raised by grandparents who, even if the kids are okay, could pick it up from their kids and be harmed by COVID?
Well, Dr. Marsh can answer that. I think he's going to say to you that the transmission rate, you know, amongst our kids is very minuscule, you know, 8th grade and down. But the other thing is just this, you know, if we just keep hesitating and we don't go back to school, well, I mean, for crying out loud, why don't we just do this? Why don't we just say, well, we're just not ever going to go back to school? I mean, let's just be ridiculous to make my point. You know, I mean, for crying out loud, it's January the 19th. If we wait and we don't go blended, we go totally remote. Now let's just follow me. Totally remote. We're not going to be going back to school until after February the 15th. I mean, there comes a point in time when the next alternative is going to be say, okay, let's go back to school on March 1st, but let's go to school until August 1st. Then what's going to be the repercussion? Then people are going to go crazy. You know, they're not going to want to do that. You know, we can't do that. Or our kids continue to suffer. And so we can't have that, and I'm surely not an advocate of going in to August the 1st. You know, we're just doing the very best we can do with what we got, what we're dealing with. I mean, when you got a third of our kids, a third of our kids are failing a core class by doing nothing but remote, and you're willing to say, well, you know, the way this whole thing's set up, because Dr. Marsh can tell you just this too. You see, after you've received your second vaccine, I was told originally that as soon as you receive it, you're 95% good to go. Okay, well, that's not true. Then I was told, not by our health experts, I just read it and everything, I guess, or saw it on the nightly news or whatever, that 7 to 10 days after you receive your second dose, 7 to 10 days after you receive that second dose, you're 95% good to go. Okay? Well, let's just go through the math. Today is January the 15th. If you got Moderna today, you're 28 days out. The very best you can possibly be is February the 13th. Okay? Now, and if you've got to wait 7 to 10 days past that, that's going to put us to February the 20th, or February the 23rd before you're 95%. But now Dr. Marsh tells me that really and truly, to be sure the antibodies are really working, you really need 2 to 3 weeks from the second dose to be completely there. So now you're March the 5th, and we're talking about an atmosphere that is extremely safe, that all the science tells us it's okay to go back to school. I don't know how else to answer it.
All right, thank you, Katie. Governor, back to you.
The only other thing that I would add to that last little thing is this, you're worried about the kids, intermingling with other kids, and then taking it home to their grandparents and everything. Well, what do you think our kids are doing today? I mean, our kids aren't sitting in a cement cinder block basement, at their house, and they haven't ever left the basement. They're all over the place. They're with all kinds of kids all over the place every day, just about. And they go back and they're with their grandparents or whatever it may be. It's just we got to just realize just one thing, and that's this: you're dealing with a pandemic. We're trying to make it as safe as we can possibly make it, and still continuing to do the very best we possibly can. That's what we're doing. And keep in mind too, we got hundreds of millions of dollars already we've poured into education, K through 12, probably well in excess of 100 million, and there's 300 million that's in the pipeline right now to come. We keep pouring more and more money in to make it safer, and that's great with me. I want to reinforce that we're going to get to any of the rural counties and everything, the health departments there and everything, continue to help us, and we'll get there with the vaccines, because we've got elderly folks that are all across this state, and we want to help in every way. I didn't lead off by doing this, but I told you, one robin doesn't make spring about what's going on with our graphs and stuff like that, but it's somewhat encouraging right now that we're going to depart on this Friday. We're not going to be back. We're going to celebrate Martin Luther King's birthday on Monday, which is fantastic. And then we're going to come back on Tuesday. And so I wanted to at least give you some news that you could take home and not just painting a rosy picture when there's not a picture to be painted that way, but really and truly our school map, our colors on our school map are getting better, and really and truly our graphs are getting better. Our daily positivity and our cumulative rate is better. Our RT rate is the very best in the entire country right now. We still read 62 names today, and that's terrible. But we're better, and there is some hope, and there's the sun coming up around the horizon, and so just hang with us, West Virginia. We're going to get there. Thank you so much.